Oh, very good evening. So, I'm Dr. Rojith from Kerala, course of country from India, greetings from our state, and thanks to the team for giving this opportunity. And the topic given to me is Young Leadership in Medicine, Shaping the Future of Global Healthcare. So now I feel more eager after coming to the Oxford. I feel like I want to study again in this university. So, moving on. So, when it comes to I'm here to raise the voice of healthcare because we have seen the coaches, we have seen the entrepreneurs, policymakers talk. So, when it comes to the healthcare, there are some myths about the leadership. That is, leadership in medicine is defined by position, title, fellowships, and global platforms. But the reality is not like that. It begins much earlier. And it is shaped by resilience and forged long before international goals are ever achieved. So I am here to share my journey to the global, from the rural setting to a global networking system. So if you look at the phases which we come across when you go into a leadership position, we have the foundation, then we have the struggle, the expansion phase, and finally we get into the global networking. Coming to the phase one, it is the foundation. So where you start does not define where you reach. So the foundation is the most important part in leadership. Especially when it comes to healthcare, you should have that knowledge or the clinical acumen. The more you expose, you get more knowledge and confidence, and the reality of treating patients who cannot afford mistakes from outside, and the decision making, learning to think, decide, and take immense responsibility. All this comes in the foundation. So the lesson one I got in my career was your environment may shape you, but your response really defines you. So for me, the foundation started without any mentorship. I started in my career schooling in a rural setup. From there, I didn't have any mentorship. Even in family, we didn't have any medical doctors from our family to guide us. But when I entered to the 12th grade, so it was a transition from a rural to urban, so my perspective started changing. First I got into the dentistry, which I never wanted to be in, but somehow I got into it. So after 1 year, I had so many obstacles for continuing this. Then I left the course, and all my certificates were held by the college, and I started visiting the court. I started learning law. For the 6 months it took for me to get back my certificates, and finally I got into my the career, the thorough medicine. So the phase two for me was the struggle. So I learned that the growth happens in uncertainty. So when you move through various sectors, bring intense questions regarding direction, opportunities, and decision identity. So do not avoid difficult environments. Those are the leadership is forced. That was the second lesson which I learned in my career. So then I started my medicine in government institution where I got all the foundation. The massive exposure has helped me to gain knowledge and confidence. The career started in a public sector, so it was entirely different for me because all my education was in government sectors. So the synthesis happened there, the dual engines of healthcare. We have a private sector on one side and we have the government sector. When you work in private sector, you driven more on the efficiency and accountability, and it is driven by optimized operations and patient expectation. In the government sector, it is more driven by mass necessity, and you have to allocate the resources properly. So the expansion phase started here, where it was beyond clinical medicine. The core was the teaching the undergraduate and the postgraduate students. Then I started participating in some international medical trials. I got engaged in research and academic publication. So I started contributing to medical education as a faculty trainer. Then I got into organizational roles as secretary and various posts like that. So the key insight I got was the recognition, the fellowship and academic roles. They are just outcomes, not goals. So working with various organizations, which helped me to improve my confidence. And these two pandemics, one is COVID-19 and Nipah virus outbreak, we were the ex-institution managing all the patients. So thousands of patients in the COVID and the Nipah virus. So there I learned the teamwork. So the final phase came as the global perspective. So the connecting local work to the global vision. So we had some students networking to the Mayo Clinic for the cessation of smoking. Then I get into the prestigious Royal College to get the FRCP, then American College of Physicians. So I started networking. And the aha moment was, for me, it was the post of appointment as international advisor post in India. And trust me, I was the youngest advisor for the college, the prestigious college. I was very proud of that. The paradigm shift of a medical leader was from how do I do to how can I contribute to a ecosystem. So the roadmap for the youngsters is start where you are, building strong clinical foundation and embrace discomfort. Face the failures. And the external focus is go beyond the bedside, network always with a purpose and always stay rooted. So local root with a global vision. And the final prescription is you do not need a perfect beginning like me to build a meaningful career, but you need clarity, consistency and courage. And to conclude with the inspiring statement by Swami Vivekananda, do not lower your goals to the level of your abilities. Instead, raise your abilities to the height of your goals. With that, I conclude. Thank you so much for listening.